My name is John Mwangi. I come from the Republic of Kenya, which is in Africa. I'm 55 years old. Sometime back in 2013-14, I started some swellings on the feet. So I went to the hospital. They did some tests. I was diagnosed with end-stage kidney failure. And the doctors in Kenya, I went to Aga Khan, I also went to Nairobi Hospital. They advised me to get a kidney transplant. There's a friend of mine who had come to Columbia, Asia for a kidney transplant. I contacted him and he advised that I can come and seek that treatment in Columbia, Asia, in India. After that, we boarded a plane in Kenya. We came to Mumbai and then all the way to Bangalore. At Bangalore, we were met by staff members of ANK. The same day, he brought me to Columbia, Asia, and the doctors immediately put me on dialysis. Following day now, we started the evaluation. There are so many tests involved before you are allowed to go for a transplant. But the surgeons, when they saw me, after 3 days, they said I cannot go for transplant because I was overweight. So they advised me to reduce at least 15 kilograms so that they can now allow me to go for surgery. And I started on a weight loss program. I started jogging, I started walking, and I started on the diet as per the advice of the doctors of Columbia, Asia.
Mr. John came from Nairobi. He was in dialysis in the Aga Khan hospital for about a year. He came to us for a kidney transplant. When he came to us, he was 115 kgs, which is a little high for doing a transplant. So we suggested that he go on a rigorous diet, and he being a good patient, he followed our diet, followed all our instructions. In a couple of months' time, he lost 20 kgs and we could do the transplant. The donor was his brother and the transplant went off well. Now John is off dialysis, doing well. He can do whatever he wants. That is the success of transplant. The main thing with transplant is the person who has kidney failure, the ideal treatment is transplantation. Because with transplantation, you can get back to near normal life.
We have been improving slowly. We have been coming for tests every week. That was on 10th May. Now this is almost a month now. Last week, the doctors said that I'm doing very well and I'm now free to go home because the new kidney was working very well, and I was also feeling very good. I could now jog, I can run, I can do so many things that I was not able to do when back in Kenya. I'm feeling very nice and I'm very grateful.